What we noticed here at Mabel, and I think the research in the wider sphere, is that students today are struggling with their well-being, particularly around mental health, and that need has been growing.
Some students who needed hearing assessments, vision assessments, things that our school-based nurse couldn't do. They were having difficulties with their home life and being able to get to a GP, to be able to get mental health care plans and those sorts of things.
So that's when the thought came about as why shouldn't we have a doctor on site? After doing lots of research around the world, we saw the benefits, particularly in the New Zealand system. We saw the benefits around how they can perform academically better. And that's when we started the process about how do we do it here at Mabel Park State High School.
So it was quite a bit of consultation to get the clinic off the ground. We worked with our local PHN and consulted with local GPs in the area. We were very fortunate to get UQ Healthcare on board, and they have the same philosophy behind what they're doing.
We have Dr. Dana Newcomb, who comes in 1 day a week. It's a bulk billing clinic, so it costs the students nothing.
There's lots of evidence that adolescents don't get the healthcare that they need. The barriers range from lack of transport, a lack of understanding about how the healthcare system works. It can be because they don't want to tell their parents what they want to talk to the doctor about. Well, this eliminates quite a few of those barriers.
It's convenient. You're not taking the student out of school for the whole period of the day, especially for students. If there's any mental health issues, they need to be acted upon straight away. So, to have somebody that's here at the school and then be able to provide ongoing services to other organisations for the benefit of that child is really important.
With my son's mental health, he finds it hard to engage with people, so he was very fortunate that this doctor was one he found easy to engage with, easy to talk to.
I could find it hard to get into my own GP, so when we heard about the doctors coming here, was a huge relief.
It was good that my mum was able to come in and convey what she thought about, my issues and stuff to the doctor, because then it helps her find out what's going on.
Seeing the same doctor on a regular basis gives both me and Hayley peace of mind.
If I tell her one thing and I go to see a different doctor, I have to say the same thing all over again. It's easier to just say it once with just one doctor, and I get familiar with that doctor and I build trust.
It's very private and confidential, so nobody else knows what that student is up in the office for. Those appointments are made discreetly, so I think that's important for all parties.
Although this clinic is physically located in the school, I don't work for the school, it's separate, so it is a confidential service. There's no sharing of information whatsoever unless the student is happy for me to talk to the guidance officers or other school staff. So I always get their permission, but most of the time they're really happy for that to happen. They really understand that we work best as a team.
The cross-agency collaboration has been brilliant, from primary health network to the school-based health nurse to the teacher to the guidance officer. It's actually helped us map all the agencies and how we work together, and now it's actually streamlining students' needs first so that they can perform academically.
It shows the parents that this is a school they can trust, that they'll actually care about their student as a person and not sort of a number.
The feedback from the community and all of the stakeholders has been all positive. We're really lucky to have the support of Training Minister and Children's Health Queensland. So they were key in helping us get this project off the ground. The department come on board and helped us around all of the legal stuff and all of that consultation and risk around establishing the clinic, and our PNC was supportive.
From CHQ's point of view, we are really committed to working differently, and this is part of doing things differently. This is what we like doing.
So we're reviewing the model at the moment. Part of that is to review financially if it's feasible for UQ Healthcare and other clinics. So far all of that is looking really positive, and even more positive than we thought it would be in the short term. We're also looking to expand the clinic, so we'd be looking to get other health providers in. So the next stage would be looking at a psychologist that the GP could refer on to. Anecdotally, we've had students' attendance increase, their engagement increase, the time they've spent in their classroom has increased.
To see them actually supported and their health and wellbeing supported so that they can learn is the number one. At Mabel Park, it's students first, and this puts students first.